Right now, as you're watching this, there's a very real possibility that the pills sitting in your medicine cabinet, the ones prescribed by your doctor, the ones you've been taking faithfully every single day, are quietly, silently damaging your nervous system. Not in some distant future, right now. And the most frightening part, most seniors have absolutely no idea this is happening until the damage is already done. We're talking about nerve pain that feels like burning fire under your skin, numbness that makes you lose your balance and fall, memory problems that get mistaken for early dementia, and muscle weakness that steals your independence one day at a time. These are not rare side effects buried in fine print that nobody reads. These are real, documented and increasingly common consequences of 6 specific categories of drugs that millions of seniors take every single day. So if you or someone you love is over the age of 60 and takes any prescription medication, you need to stay right here, because what you're about to learn in the next 20 minutes could literally protect your brain, your nerves, and your quality of life. Before we get into the specific drugs, it's important you understand why seniors are so much more vulnerable to this kind of nerve damage than younger adults. Your nervous system is made up of billions of delicate nerve fibers that carry signals between your brain and the rest of your body. These signals control everything: your ability to feel heat and cold, to maintain your balance, to move your muscles, to digest your food, and even to think clearly. When you're young, your body has a remarkable ability to repair and protect these nerve fibers even when they're under stress. But as you age, that protective capacity naturally declines. Your kidneys and liver, which filter and process medications, become less efficient, meaning drugs stay in your system longer and at higher concentrations. Your fat-to-muscle ratio changes, which affects how medications are distributed throughout your body. And many seniors are taking not just 1 or 2 medications, but 5, 6, 7 or even more simultaneously, a situation doctors call polypharmacy, which dramatically increases the risk of interactions that can harm the nervous system in ways no single drug would cause on its own. Now here's something that's critically important for you to understand before we go any further. Nothing in this video is medical advice. You should never stop taking a prescribed medication without talking to your doctor first. Suddenly stopping certain medications can actually be dangerous. What this video is about is giving you the knowledge and the questions you need to have an informed, empowered conversation with your healthcare provider. Knowledge is protection, and that's exactly what we're here to provide. Let's begin with the first class of drugs, and this one is going to surprise a great many of you because it's one of the most commonly prescribed medications in the world for seniors. We're talking about statins, drugs like Atorvastatin, Simvastatin, Rosuvastatin, and Levaquin, prescribed to millions of older adults every year to manage cholesterol and reduce the risk of heart attack and stroke. Statins do save lives, and we want to be completely clear about that. But there is a well-documented and often under-acknowledged side effect that affects a significant portion of the people who take them, and it specifically targets the peripheral nervous system. It's called statin-induced peripheral neuropathy, and the way it works comes down to a molecule called coenzyme Q10 or CoQ10. Statins work by blocking a pathway in the liver that produces cholesterol, but that same pathway also produces CoQ10, a powerful antioxidant that your nerve cells absolutely depend on for energy production. When CoQ10 levels drop, nerve cells become vulnerable to oxidative stress and damage. The symptoms often start subtly: a slight tingling in the feet, a sense of numbness in the toes, a feeling like you're walking on sand or pebbles, even when you're standing on flat ground. Over time, this can progress to balance problems, weakness in the legs, and a significantly elevated risk of falls. If you are taking a statin and you have noticed any of these sensations, please bring this up with your doctor immediately. Ask about having your CoQ10 levels tested. Ask whether a dose reduction might be appropriate, and discuss whether supplementing with CoQ10 is a reasonable option for your specific situation. Moving on to the second drug category, this one is just as widespread and possibly even more surprising to hear about. Proton pump inhibitors, commonly known as PPIs, are medications like Omeprazole, Pantoprazole, Lansoprazole, and Esomeprazole. You probably know them by brand names like Prilosec, Nexium, or Protonix. They are prescribed for acid reflux, heartburn, and stomach ulcers, and many seniors take them every single day, sometimes for years at a time, without ever revisiting whether they still need them. The problem with long-term PPI use and nerve health comes down to one critical nutrient, vitamin B12. Stomach acid is essential for releasing vitamin B12 from the food you eat so it can be absorbed into your bloodstream. When you suppress stomach acid with a PPI over a long period of time, your body's ability to absorb B12 drops dramatically. And vitamin B12 is not just another vitamin. It is absolutely essential for the health of your myelin sheath, the protective coating that surrounds every single nerve fiber in your body. Think of myelin like the plastic insulation around an electrical wire. When that insulation breaks down due to B12 deficiency, the nerve signals become scrambled. The result is a condition called subacute combined degeneration of the spinal cord in severe cases, but even mild B12 deficiency produces symptoms like tingling in the hands and feet, difficulty walking, fatigue, cognitive fog, and depression, all of which are tragically often written off as just normal parts of aging. If you've been on a PPI for more than 3 months, ask your doctor to test your vitamin B12 levels. The test is simple and inexpensive, and catching a deficiency early can prevent irreversible nerve damage. Now let's talk about the third category, and this one hits particularly close to home for millions of seniors who struggle with anxiety, insomnia, or agitation. Benzodiazepines, drugs like diazepam, lorazepam, alprazolam, and clonazepam, are among the most widely prescribed medications for older adults, despite the fact that virtually every major medical guideline explicitly recommends against their routine use in seniors. The reason they're so concerning from a neurological standpoint is that they work by enhancing the effects of a neurotransmitter called GABA, which essentially slows down your central nervous system. In the short term, this produces a calming effect. But with prolonged use, your brain begins to adapt to this constant chemical suppression in dangerous ways. Nerve cells that are naturally responsible for excitatory signaling become dysregulated. The brain's own natural production of GABA-related chemicals declines, and over time the cognitive effects can be profound and lasting. Memory impairment, slowed processing speed, and an increased risk of developing dementia. On top of these central nervous system effects, benzodiazepines dramatically increase the risk of falls in seniors by impairing coordination and reaction time, and falls in elderly individuals are among the leading causes of serious injury and loss of independence. If you are currently taking a benzodiazepine, please do not stop it abruptly. That can cause seizures and can be life-threatening. But do have an honest conversation with your doctor about a supervised gradual tapering plan and about alternative approaches to managing anxiety or sleep that carry far less neurological risk. The fourth drug category is one that is commonly prescribed for a wide variety of conditions, from chronic pain to depression to bladder problems, and it's a category called anticholinergic medications. This is a broad group that includes drugs like Oxybutynin for bladder issues, diphenhydramine, which is actually the active ingredient in many over-the-counter sleep aids and antihistamines, tricyclic antidepressants like Amitriptyline, and certain antipsychotics. What all of these drugs have in common is that they block a neurotransmitter called acetylcholine, which plays a crucial role in both the peripheral nervous system and the brain. In the short term, this can cause dry mouth, blurred vision, constipation, and confusion. But the long-term neurological consequences in seniors are deeply concerning. A landmark study published in JAMA Internal Medicine found that prolonged use of anticholinergic drugs was associated with a significantly increased risk of dementia. The cumulative effect, meaning the more of these drugs you take and the longer you take them, the greater the risk to your brain. This is particularly alarming because many seniors are unknowingly taking multiple anticholinergic drugs simultaneously without any awareness that the combined burden on their nervous system is multiplying. Ask your doctor or pharmacist to calculate what's called your anticholinergic burden score. It's a measure of how many of these drugs you're taking and their relative potency, and discuss whether any of them can be safely reduced, switched, or eliminated. The fifth category on our list today is one that has been making headlines in recent years, and for very good reason. Fluoroquinolone antibiotics, drugs like ciprofloxacin, levofloxacin, and moxifloxacin, are powerful broad-spectrum antibiotics that are frequently prescribed for urinary tract infections, respiratory infections, and other bacterial conditions in seniors. The problem is that these antibiotics have a well-documented and sometimes severe side effect profile that specifically involves the nervous system and connective tissue. The FDA has issued multiple black box warnings, the strongest type of warning a drug can carry, about the risk of peripheral neuropathy associated with fluoroquinolones. This neuropathy can appear within hours to days of starting the antibiotic, and perhaps most disturbingly, it can be permanent even after the drug is stopped. Symptoms include burning pain, electrical shock sensations, weakness, and sensitivity to touch in the extremities. There's also a phenomenon that some patients and doctors have started calling fluoroquinolone toxicity syndrome, which involves a complex constellation of neurological, musculoskeletal, and psychiatric symptoms that can persist for months or years. If you are prescribed one of these antibiotics, ask your doctor whether a different class of antibiotic would be equally effective for your specific infection. In many cases, the answer is yes, and the neurological risk simply isn't worth taking when safer alternatives exist. The sixth and final drug category we need to discuss today is one that surprises almost everyone who hears about it, because these are medications prescribed specifically to help the nervous system, yet they can paradoxically damage it under certain conditions. We're talking about certain anticonvulsants and mood stabilizers, particularly medications like Phenytoin and to a lesser extent carbamazepine, which are used to treat epilepsy and nerve pain. Phenytoin, in particular, has been known since the 1970s to cause a form of peripheral neuropathy with long-term use characterized by reduced sensation in the feet and legs, decreased reflexes, and in some cases cerebellar atrophy, which is actual shrinkage of the part of the brain that controls coordination and balance. More recently, Gabapentin and Pregabalin, which are now among the most prescribed drugs in the world for nerve pain, fibromyalgia, and even anxiety, have come under greater scrutiny for their potential to cause paradoxical worsening of neurological symptoms in some patients, including cognitive impairment, dizziness, and falls. The key takeaway here is that even drugs designed to treat nerve problems can have significant neurological side effects, particularly when used at high doses or for extended periods. If you're taking any anticonvulsant, long-term regular blood level monitoring and periodic neurological assessments are essential safety measures that your doctor should be conducting routinely. Now, there are several things that every senior and every caregiver for a senior should be doing proactively to protect neurological health in the context of medication use. First, keep a complete and updated medication list, including over-the-counter drugs, supplements and herbal remedies, and bring it to every single medical appointment. Many doctors don't have a full picture of everything their patients are taking, especially when care is divided among multiple specialists. Second, ask for a medication review at least once a year. This is sometimes called a brown bag review or a comprehensive medication reconciliation, and it's a formal process of evaluating whether every drug you're taking is still necessary, still at the right dose, and still not interacting harmfully with your other medications. Third, pay close attention to your body and take new or changing symptoms seriously. Tingling, numbness, new balance problems, increasing cognitive fog, muscle weakness, none of these should ever be dismissed as just getting older without first ruling out medication as a contributing cause. Fourth, make sure your diet is supporting your neurological health. Vitamin B12, vitamin D, omega-3 fatty acids, and magnesium are all nutrients that play critical roles in nerve function, and deficiencies in any of these are both common in seniors and frequently worsened by certain medications. Fifth, stay physically active within whatever capacity is safe for you, because exercise has been shown to support nerve regeneration, improve blood flow to neural tissues, and protect cognitive function in ways that no medication can fully replicate. The relationship between seniors, medications, and neurological health is one of the most important and most overlooked areas of geriatric medicine today. We live in a world where prescribing a new pill for every symptom has become the default response, but every medication has consequences, and the nervous system, your brain, your spinal cord, and the miles of delicate nerve fibers running through your entire body bears more than its share of that burden. You deserve to know what is going into your body, what it is doing inside you, and what questions to ask to make sure the treatments meant to help you are not simultaneously causing hidden harm. To summarize everything we've covered today, 6 major drug categories: statins, proton pump inhibitors, benzodiazepines, anticholinergic medications, fluoroquinolone antibiotics, and certain anticonvulsants, Each carry real and documented risks of neurological damage, particularly in older adults. The most important actions you can take are to get informed, get your levels checked, ask your doctor the right questions, never stop a medication abruptly without medical supervision, and advocate fiercely for your own health. If you found this information valuable and you believe it could protect someone you care about, please share this video right now, because this is exactly the kind of knowledge that can change lives. Make sure to subscribe to this channel so you never miss a video. Hit the like button if this helped you, and drop a comment below telling me which medication you'd like us to cover in more depth next, or share your own experience. Your story might be exactly what someone else needs to hear today.